Hello, this is Dr. Harpinder Shevchenko from Smile by the Sea Family Dentistry in Hampton, New Hampshire. And today we're going to talk about lip, mouth, and tongue lesions. What are mouth lesions and what kind of symptoms should I be monitoring? So let's take up what are mouth lesions first. As kind of the name explains, so lesions are like it could be something in simple terms, almost like looking like I have a scratch on my gum. It could be I have a little bit of a swollen area in my mouth. It could be near gum. It could be on the inside of the lip. It could be a little bit outside of the lip. It could be inside the cheek, on your tongue, on the roof of your mouth, kind of like going towards your throat. It could be a little raised area. It could be almost looking like a pimple or what we call like a canker sore kind of area. So those kind of like are the common lesions, what we say in your mouth, one can encounter. And and they can vary, like it could be something very simple where very typically we see somebody burn the mouth or the roof of the mouth. Very typically we see is with the pizza, or got a cut with the cracker, or got a cut with the chips. In summertime we see that quite often, and everybody is different, everybody's body reacts differently, and sometimes you can actually have it to be that it kind of gets a little bit swollen around it and it hurts when you eat or drink, something like that. Or it could be more invasive where it is actually you're getting almost like a big canker sore where it's really painful or it's kind of swollen. And other could be, some lesions could be what we call them bad lesions. They could be actually, type of cancers. As we know, certain cancers are that we call them benign because they don't travel anywhere else in the body, this remain in that area. It could be that kind of a lesion, or it could be something that there's some bad cancer going on in the body, in other parts of the body, and is showing up in the mouth. So they can vary from very innocent area which could heal on its own to something very aggressive. So the rule of thumb is that don't ignore it, get it checked out right away. If you have a dentist, give them a call when you notice it. You can wait a week or so, see if it goes away. Otherwise, I always advise my patients, if you're seeing something, it's always good to come in and then get checked out. It gives you peace of mind. It gives us peace of mind as well too. What can cause these sores or lesions in the mouth? Like, for example, canker sores or blisters, or as we talked a little bit earlier, even some kind of, worse kind of lesions, which can be precancerous or full-blown cancerous lesions. So talking about the canker sores, sometimes it's a lot of times patients have some sort of allergic reactions or sensitivities to some foods that could cause it, or other could be there's some deficiencies in certain vitamins that could cause it. And sometimes I have seen patients, if they're taking certain kind of medications for certain health conditions, and they kind of get prone to developing those because your immune system kind of goes down, as we say, like, it's not fighting at the full capacity. And these kind of viruses, which typically are mostly responsible for causing these canker sores, they get the opportunity to create that, so that it could happen like that. And the more worst kind of lesions, like as we said, like the precancerous or cancerous lesions, they are again like, if somebody might have a cancer going on elsewhere in the body and it kind of shows up in the mouth. And actually, one other kind we see like a whitish lesions could be fungal lesions, what we call candidiasis, like fungal lesions. So some fungal growth, again, it comes from if your immune system is stressed, the fungus gets a chance to grow in. Another wider kind of lesions could be that somebody, they're doing a cheek biting. You could see some of those white lesions. So those are some kind of lesions, again, that could be in your mouth, and some of the causes for those lesions. So the lesions that I mentioned just now, they were more kind of like, from color point of view, they look like your gum color, a little bit reddish, a little bit pinkish, some swelling, and some kind of like an ulcer in the mouth. But there's another kind of lesions which we call, they're like white lesions in the mouth that could happen. And one of the very common that happens is from a fungal infection. We call it candidiasis. Somebody could have like patches of that, like white patches from the fungal disease. And other lesions that could look like a white, sometimes they almost look like fluffy, little bit raised surface. And patients, if you end up, biting your cheek more frequently, you kind of see that line along the gum line. Sometimes it was a worse bite in the mouth, it could even become more raised and also more whitish too. So those are some of the white lesions that can happen in the mouth. There are other kinds too, which can also are more patchy white lesions, and they can be caused by some of the immunosuppression. Like if your immune system is suppressed, you have some certain other predisposition to some autoimmune diseases that can show up in your mouth as well too. Are mouth sores or mouth lesions contagious? So it depends on what is causing that lesion. Some of the lesions, like that come around the herpes lesions that are around the lip, they are very contagious. They can spread from person to person. Others, not so much. If someone has like a white patchy area which came from the cheek biting or some of the other from any fungal disease, that is usually not transmitted. But most of the time, the transmitted ones are, or that can be spread around, are the ones which are more of like canker sores, which are called by the herpes virus. Can you get dental work done, or can a patient get a dental work done if they have a mouth sore present? So it depends what kind of a mouth sore is that. So you, first thing is that you immediately want to contact your dentist and have them evaluate. So they will evaluate what kind of a mouth sore is that. Is that something benign? Is that something it was just simply a pizza burn or just a simply a cut, and they're going to be doing some very non-invasive procedure, and it's not going to make that lesion worse or impede in the healing process of that lesion? Or is that something that needs to be checked out by another specialist? So immediately talk to your dentist, and depending on what kind of lesion it is, and the dentist will decide whether the treatment can be rendered or it should be postponed until the cause of the lesion is found and the lesion fully heals. How are the sores or lesions evaluated during a dental visit? So actually during a dental visit, whether you go to the dentist for the first time or you're going there for your routine examinations, part of the checkup does involve looking into your oral cavity, looking at how the inner lining of the lips look like, how's your tongue looking like, how is your teeth tissue looking like, roof of the mouth, and part of beginning part of your throat. So we actually mostly we're evaluating those clinically, looking very carefully with a lot of dentists, as you might have known, that wear those specialized glasses which can help them diagnose things which are even smaller, because your field of view is much better, so you can see things a lot better. And we can evaluate from the look clinically how things are looking in your mouth, and the feel of it. We are feeling those areas as well too when we are doing the examination. And there's also specialized oral cancer screening devices nowadays that we use that as well too, to if there's any lesion which we are suspicious about, we can utilize that as well too. How can a patient differentiate or figure out whether this is a minor sore that could go away on its own, or is there something that I should get looked at? So like, it's kind of a more of a gray area. So very first thing is that you could do is wait 1 or 2 days or even a week and see how, if it's the stays the same size, it is not progressing, it's not getting bigger, it's not getting more wider, it's not spreading around, and it's not filling up with any fluid. If it's kind of, you want to check it every day, and if it's looking like it's the same size or it's shrinking, and then just wait every day by day. And if it's not gone by the 1 week mark, or if you see that from day 2 to day 3 it has increased a lot more, definitely get a consultation with your dentist and have them evaluate it. So typically the rule of thumb is seeing every day how it's going. Do not wait too long. If you're feeling that every day is getting worse, or even sometimes patients may say like, oh, in the morning it was just a little bit of irritation, and by the night came I was feeling a lot more. So that is a sign that, okay, something is going on more aggressively and you want to get that checked out right away. When should a mouth lesion be checked for oral cancer? So when you come for evaluation, we will take a look at it and take the pictures and write down our findings, and then based on how it's looking like, it could be that we might send you for a further consultation with the oral surgeon for a biopsy of the area. Or it could be that we will say, let's monitor this area for a week to 2 weeks and then come back in, evaluate the area again. If it is all healed up or is healing up, then we might wait another week or two. But if we are seeing there's no change or it's getting worse, or even if you're starting to feel any more symptoms about it, then definitely we're going to send you for a biopsy to the oral surgeon, and they will do the biopsy and send the report back to us. And they will also know the report as well too, that whether it's something to be concerned about, is it something just benign that is just sitting there, will resolve on its own, or is that something is going to require some more intervention. What treatment options are available? So treatment options depend on what kind of lesion we are seeing in your mouth. If it's just a simple, aphthous ulcer, some patients do get them more often than the others, and many times they actually resolve on their own. So you will be just, recommended to avoid certain kinds of foods or certain kinds of irritants so that your own body can heal things faster. Or the other could be that sometimes we prescribe some oral creams to put on. Sometimes it could be some medication that you could be put on, and other times it could be that we need to do a biopsy and wait for the results, and the treatment recommendation will be based upon the results of the biopsy. But what should a patient do if they come across a blister or a lesion that is not healing? So the first thing you want to do is call your dentist, get it evaluated immediately. If you have that lesion or the blister for 1 to 2 weeks and it's not changing, it's not healing, or it's getting worse, you want to get seen right away. So get it checked right away. Once your dentist sees you, they will take a look at it and they will determine from there what course of action is needed. So make sure that we can catch things early on before anything else spreads out. So get it checked right away. I hope I was able to answer some of your questions regarding lip, tongue, and mouth lesions and ulcers. If you have any other questions, we are here to help you. Please give us a call at 603-926-8827. You can also submit a request to our website, which is www.smilesbythecnh.com. We are here to help you. Give us a call. We'll be happy to take a look at it and guide you through it.